One of the most common misperceptions that I hear about diabetes and foot ulcers is when patients say that if the ulcer was serious, it should have been painful. That couldn't be further from the truth. When you have diabetes, one of the complications that are experienced is a lack of protective sensation. Diabetes can affect the nerves in your feet, reducing your ability to feel pain, reducing those alarms that go off when you injure your foot. So it's very easy for people to undergo serious injury, ulcers, stepping on a foreign body, splinters, and have it go unrealized or delay medical treatment because it doesn't hurt. The lack of sensation and lack of pain associated with the wound doesn't necessarily mean that it's not a serious injury when you have diabetes and you have an injury to your foot. One of the most disappointing things for me in treating diabetic limb complications in ulcers of the foot and ankle is recognizing an ulcer that could have been prevented. One of the first things to appreciate is that many of the diabetic foot complications that we see can be prevented with annual exams and surveillance of the foot and ankle. The majority of diabetic limb amputations begin with an ulcer, often a small ulcer, but an ulcer that becomes progressive, infected, leads to a larger wound, and ultimately results in lower extremity amputation. Diabetes affects many organ systems of the body, and many that include the foot. What often starts as a small wound, goes unnoticed or neglected, can often become infected because diabetes affects your ability to sense wounds, your ability to heal wounds, fight infection, and this often leads to lower extremity amputation, many which can be prevented.